Why is the meniscus so important? So let's talk about what the meniscus is and talk a little bit about the relevant anatomy. So what is the meniscus? They are crescent-shaped wedges of fibrocartilage, and they're very important for load transmission and shock absorption. They're also important for joint lubrication, joint stabilization, and proprioception. And here's the thing. They are critical to prevent wear and tear within the joint. And once you have an injury to the meniscus, and we'll talk about some of the research on this a bit later, you have a cascade of things occurring that causes more damage within the joint over the course of time. So after you have an injury to the meniscus, all of these things are altered. And there is a feed forward mechanism that occurs. So basically, after you have a little bit of injury to the meniscus, there's decreased ability for the tibiofemoral joint to handle load transmission and shock absorption. There's less lubrication, less stabilization, and less proprioception, which can lead to more damage. And more damage leads to more damage. And you have this speeding up effect, this feed forward mechanism. Once you have some damage, it can continue speeding up over the course of time. And that's why we are so concerned about restoring the meniscus if it does get damaged. Okay. So I apologize if you're listening to this on the podcast. I recommend you go to YouTube if you want to see some images as well as a model of the knee joint so you can see where the meniscus is and how it is potentially so important. Otherwise, you can kind of skip ahead. But anyway, the image I'm showing you down below is going to be the top portion of the tibia. Basically, they've taken the knee joint apart, and this is the top of your shin bone or the tibia. And this would be the medial side of the joint. You can see the medial meniscus. It's like a crescent-shaped C, okay? On the other side, you have the lateral meniscus. The same thing. It's a C shape. It's kind of like two C's facing one another, okay? Or two magnets kind of facing one another, right? In this image on the left here, you have your femur bone, your thigh bone, and you have your shin bone, your tibia, and the meniscus sits right between the two. So you can kind of appreciate how important this is for stability of the joint as well as shock absorption because it sits right between the two bones. And when I jump, land, change direction, weight lift, those two bones are going to be squishing together. The meniscus sits right in that area to help to dissipate some of the forces from doing our favorite things in the gym, right? I also have my knee joint right here. So we have our femur bone or the thigh bone, and underneath of it, we have the shin, right? This big bone right here is going to be the tibia. And then this bone right above is the patella. So if we open up the joint and I show you the inside, on the top of the tibia, we have the medial and the lateral meniscus, right? From here and here. And then we can also appreciate how there is a C-shaped meniscus that goes across both of those right here, right? So that's where it sits. Now, if I do jumping and these joints are banging together, you can see that meniscus is going to be very, very important for load transmission. Okay, right? So the meniscus is absolutely critical to prevent more wear and tear in the joint. So how do we know this? So it's based on some research. So they have information on folks long-term, right? 30, 40, 50 years, and they're looking at how much knee arthritis they have. Okay. So in this study, they were looking at folks that develop knee osteoarthritis over the course of 30 years. So they have a 30-year follow-up. And they look at the folks that have knee osteoarthritis. And they had information on these folks 30 years prior. And the folks that had meniscus damage 30 years prior, it was more common to have knee osteoarthritis than folks that had no meniscus pathology 30 years ago, right? So 54% of the folks with knee arthritis ended up having some meniscal damage at baseline, whereas the folks that didn't have arthritis had 18% chance of having knee arthritis, okay? So if you have meniscus pathology, meniscus injury, you're more likely to have future arthritis. And they didn't look specifically at how bad the damage was. I'm guessing that if you have more pathology early on, it's going to lead to more pathology, more osteoarthritis over the course of time, right? The other place you'll see osteoarthritis and meniscus injuries pop up, and hence you'll see the correlation, is after partial meniscectomy. We'll talk about this surgery a little bit more in depth in the future, but basically if they trim out part of the meniscus after you have an injury, we know that over the course of time, more degeneration of the knee occurs. So in 10-year follow-up studies, you'll see joint space narrowing after partial meniscectomy, 22% joint space narrowing on the medial side and 38% on the lateral side. And if you follow these guys out even further, so after 20 years, you'll see a 56% osteoarthritis rate in lateral meniscectomies. Now, that doesn't sound phenomenal, right? So if you get your meniscus trimmed out after you have an injury, you have a pretty, darn increased risk of gaining arthritis over the course of 10 or 20 years. The other piece, and we alluded to this earlier, is that the amount of resection during the meniscectomy is going to correlate with the rate of degeneration. And this kind of goes back to the idea of the feed-forward mechanism. So in this study that I've cited, and you can check all the citations and references in the show notes, partial removal of meniscus tissue can increase peak local contact pressure within the knee joint by 65% and reduce contact area by 10%. So if I take out a little bit of meniscus, right? If I'm a surgeon, I take out a piece of your meniscus after an injury, and I'm going to decrease the surface area available to dissipate force. This is going to increase the local contact pressure within the joint. Okay. Another study, resection of 15 to 34% of the meniscus tissue additionally enhances the load of the hyaline cartilage by up to 350%. Okay. So we talked about the knee joint earlier. I showed those two bones, how they bump together, right? And the meniscus sits between the two. And if I start taking out pieces of the meniscus, I increase some of the stress on the cartilage. And if you get enough stress on the cartilage over the course of time, you can have more arthritis, potentially more knee replacements eventually, which is something we obviously want to try to avoid. So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain-Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay, so a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a Fitness Pain-Free Mini Course. Definitely check this out.